Welcome to the 422 Business Show. I'm your host, Patty Siegel, an advertising manager of the Route 422 Business Advisor, which serves business owners on the Route 100 and 422 corridors in Reading and Chester counties and Berks counties since 1995. Today, my guest here is Dr. Abraham Munabi, and he is with the Reproductive Science Institute of Greater Philadelphia. Welcome.
Thank you for having me.
You're very welcome. Glad you could make it. Can you tell us a little bit about the Reproductive Science Institute?
Well, the Reproductive Science Institute was started in 1991. We have two offices, two locations in Wyoming, Reading, and in Wayne, Pennsylvania.
Oh, great.
It was started to provide comprehensive infertility treatment for both men and women in one setting.
Excellent. Okay. Now, you are the founder, is that correct?
Yes, I am.
Congratulations.
Thank
What
you.
inspired you to start a practice like this?
Well, I used to work as a reproductive endocrinologist, director of reproductive endocrinology in hospitals and universities. I even rose to the rank of an associate professor. But I still felt that I needed to provide a more compassionate treatment to most of my patients in a single setting, a place that has easy access for patients to get treated.
Great. Okay, so along those lines, what services do you provide your patients, both men and women?
As I said, we provide comprehensive infertility evaluation and treatment. We specifically provide in vitro fertilization. We treat patients using donor oocytes. We perform pre-implantation genetic diagnosis for people who have genetic problems. We provide family balancing and also treat some reproductive gynecological conditions such as endometriosis and polycystic ovarian syndrome or disease.
Okay, great. Sounds like it's a lot encompassing. So can you talk a little bit about technology that's evolving today versus, let's say maybe 5 or 10 years ago? What's new along the lines?
Actually, I've been there from the outset of reproductive technology here in the United States. Even before the first baby was born in the United States, I was involved in reproductive endocrinology as a fellow at NIH, and we used to go to Norfolk to learn these things. And it has evolved tremendously, and the success rate has really improved greatly. For example, we are now able to help women with reproductive failure, like repeated miscarriages. We can now identify some of the genetic problems that are behind these repeated miscarriages.
Such as?
We have a Robertsonian translocation, for example. Usually most of them are usually common abnormal chromosomal combinations.
Okay.
We can now go in, do in vitro fertilization, take a biopsy from an embryo, identify the chromosomal aberration in that embryo, and transfer only those embryos without that genetic problem.
Okay, good. Sounds like there's a lot involved there. Is that right?
Quite a little bit is involved, yes.
Yeah, I guess each client is more specific than, say, the next.
That's correct. Actually, one of the reasons I went is to provide individualized treatment so that each and every woman in front of me is looked at as an individual rather than all sizes fit all. This is not what we look for. And each person has specific problems that they have to be addressed. That's why we use a collaborative team. All members of our staff are asked upon to comment and evaluate and be able to advise us as to what we can do for that single patient so that we can prevail. Okay,
good. Good. Now, can you talk a little bit about, I'm sure like every business today, there's increased competition, even in fertility. Just talk about what sets you apart from, say, your competition.
I've been meaning to answer this question. We set comprehensive infertility treatment in one roof. In fact, we are one of the few centers in Pennsylvania that have been so licensed to provide all services in one place, including a surgical center. because such centers, by definition, they have to be independent of the doctor's facilities, but I was given an exemption for that. So everything is under one roof. We provide flexible schedules. We work 365 days.
Nice.
We sometimes do better than the post office. During this last storm, we were open and the post office didn't deliver, so that is a testament to what we can do.
Good.
And we provide individualized care, and we always try to make it affordable compared to, let's say, institutions like hospitals and universities. Yes, we have competition around, but we try to really go for the individual. We are not into the statistics. We are here to help individuals achieve their dreams.
Okay, good. Now, along those lines, do you have financing available for things like this?
Yes, we make it affordable to begin with, but also we have a dedicated person who gives our patients treatment options and financing options out there. We also work with the financial institutions that can help with the financing, and the qualification for that credit is less stringent.
Right.
And usually they are very understanding. But all in all, we try to work with those individuals to make it affordable for them.
Okay. Do you have a percentage rate of being able to help people? I don't know if you've done any statistics along those lines.
You mean the success rates, or?
Yeah, but let's say a couple comes to you and says, we're having trouble getting pregnant. Are there statistics that RSI has helped out? Like, can you help out 90%, 70%?
We usually, statistics are such that almost 65, almost 70% of people can be helped. There are people who will never be able to achieve pregnancy no matter what we do. Mm-hmm. But because of the donor oocyte and gestational carriers, we are now able to increase that percentage upward of 70 to almost 85%.
That's great. That's very nice. Good. What business challenges are you facing these days? Like, I know so many businesses have challenges, and I'm just curious if yours is up against anything.
Oh, we are up against great odds. Ours is an emotionally charged problem, but it is social medicine. It is not acute medicine or critical medicine. So we are interwoven with the economy. Mm-hmm. So if the economy goes down like it has, right, then people tend to postpone these very expensive treatment options. And so because they can afford to wait until until the economy turns around. Usually, most people fear that they might lose their jobs. Even if they are still employed, they might say, "Well, we might lose our jobs, so we better not embark on these expensive treatment options." That is one. The other is that we deal with in a world where electronic and media is always there, and they look at the negative, not so much negative, but the adverse side effects of our treatment. For example, the Octomom, and people think that we are there to do things that are not acceptable in society. Whereas, in fact, those are just complications of therapy. And in fact, most of the complications of the multiple pregnancies spring from the fact that the insurance companies do not cover infertility. Even if they say they cover only diagnosis, they never cover the treatment, which is the most expensive option for that. So that makes it difficult for us. The big institutions like hospitals and universities, they have a lot more leeway in terms of caring for these patients. For example, they can beg and they don't pay tax.
Sure.
So we are a small business and we have to compete with those people as well.
Right. I can't remember her name off the top of my head, but remember the actress that just had, I think, 7 or 8 babies at once?
The Octomom, yes.
The Octomom, right. Yes. What was, I don't think she's an actress either, but what was given to her? Do you have any idea? I'm sure it wasn't RSI, but...
No, my understanding is that she's a single mom, that she had 6 children before, and she wanted a 7th child. She's unemployed, and her parents were being foreclosed on, and she still went for this treatment option. And the doctor meant to transfer 6 embryos for some reason, which is way in excess. But he must have done what they call assisted hatching. So 2 of those embryos then split to make it 8. But in actual fact, with the in vitro fertilization, you can control the number of embryos you transfer. Usually we don't transfer more than 2 for women who are under the age of 36. But most of these multiple pregnancies spring from injectable medication without in vitro fertilization. And that's where, because there is no control on how many embryos or how many eggs will ovulate or fertilize.
Okay, good. That's good to know. Can you tell me just a little bit about what role does it play in your practice today?
Well, technology has made it easy for us to diagnose reproductive failures more extensively and quickly. And also, we have been able to treat some of those reproductive failures, especially the genetic conditions that we talked about. To the extent that we now provide some of those patients who were afflicted with either sickle cell or thalassemia or Tay-Sachs, we can go in and identify the gene and be able to identify the embryo that doesn't has that abnormality and transfer that embryo, and hopefully that family can have a very good outcome.
Good, good. So there's a lot of technology and a lot of emotional involved, it sounds like.
A lot of it,
yes. Okay, good. So tell us about what the future holds for RSI. Where do you see yourself heading?
Well,
a couple of years.
We have to continue to provide our compassionate care as we have. We shall continue to provide these services to more people. We shall try to make it more affordable to them, and we in fact have dedicated people to explain some of the finances, and because we are self-contained, we tend to be a lot cheaper than hospitals and universities.
Okay, good. Now, where can somebody go to learn more about RSI? Do you have a website or?
Well, they can contact us at rsiinfertility.com, or they can call us at 610-981-6000. That is 6000.
Okay, sounds very informative. Thank you very much, Dr. Munabi, and I appreciate the interview.
Thank you for having me.